Orgasm. It's arguably the most pleasurable human experience. But what if your desire for orgasm turned into an insatiable need?
I just know that an orgasm is the only way to get rid of this feeling.
I use my vibrator and it takes up to 6-7 hours.
Or what if having an orgasm made you sick?
I just didn't feel good after sex. It's similar to like a hangover.
I had a lot of complaints.
These individuals and many more suffer in silence from rare and mysterious conditions that affect their sex lives.
It's not yet known in general medicine.
People don't like to talk about it. Sex is still taboo.
I'm Maryanne Demasi. Join me on a journey as I explore the complex world of those for whom orgasm has been an unrelenting nightmare.
My journey begins with a ferry crossing to an island off the south coast of England.
I'm about to meet a woman who is constantly on the verge of an orgasm. No, she's not a sex addict, far from it in fact, but she can bring herself to have over 40 orgasms a night just to get relief.
Understandably, she doesn't want to be identified, so we'll call her Sandra. It's not known exactly what triggered this condition, but Sandra's symptoms began after injuring her lower back in a horse riding accident 8 years ago. She's now in her 60s. As I'm talking to you now, what are you feeling?
Aching and throbbing, pure physical frustration at having engorgement and strong desire for orgasms. It's totally bizarre.
The feeling constantly builds. The need to climax becomes overwhelming. Every 6 days, Sandra becomes desperate for relief.
I hate the word masturbation, so I call it having a sorting out. I go up to the bedroom and I organise my equipment and a fan because I get so hot. And I use my vibrator, and that can last up to sort of 5 hours. And I only stop when I feel I've got to the stage where I can't possibly have another one. And by that time, I'm usually sort of sobbing, and in a real state, I'm actually trembling from the effort of it all. And at the end of one of these mammoth sessions, it's relieved a bit, but not as much as it should be.
Is there any sexual desire at all?
Sexual desire involves the feeling of emotional excitement and randomness and horniness. But what I feel is no more sexy than wanting to scratch.
I went to visit Sandra's doctor in London. David Goldmeyer is a psychiatrist at St Mary's Hospital.
Ah, lovely to meet you.
He diagnosed Sandra with a condition called Persistent Genital Arousal Disorder.
It's an uncomfortable, distressing feeling. Really, until she came to see us here, she didn't know what it was all about.
It's thought that this condition is rare, but it may be that this condition is rarely diagnosed.
There's a great danger they can be misdiagnosed as hypersexual. One of the hallmarks of this condition is that it's not associated with sexual desire really at all. They really don't want anything to do with sex. It becomes unbidden and unwanted.
Early theories suggested these patients were psychiatrically unstable. However, this has been strongly refuted, as many sufferers like Sandra are found to be psychologically sound.
Since this condition has only been defined in the last few years, there's very little that can be done to help these patients. But there is one man that's dedicated the last 10 years to trying, so I'm off to the Netherlands to pay him a visit.
The red light district in the nation's capital, Amsterdam, is a throbbing attraction for sex and erotica. It is also home to Dutch professor Marcel Waldinger, a world authority on rare sexual syndromes. He first heard about this persistent arousal in 2004.
Well, initially, I thought it is very rare. But now I've seen so many women that we actually can't handle it anymore. A lot of them had complaints of an overactive bladder and restless legs. At the same time, it was also clear to me that this was a physical disorder and not a psychological disorder. That's why I decided that it had to have another name. I called it restless genital syndrome.
It's this unrelenting arousal that has left Helena's sex life in tatters.
After the orgasm, I've got relief for like 2 or 3 minutes. But after that, it really builds up real fast. And then it's even worse than before the orgasm. It was so bad that...
It's because of this that Helena doesn't want to have sex anymore.
I had a boyfriend who really, really liked sex. And because of me then wanting to have orgasms anymore, for him the pleasure really decreased a lot. So it really affected my relationship.
The stigma of this disorder often marginalises the sufferers.
Very soon I found out that talking about my disease is very hard, even with my closest friends. When I tell them, they really, they start laughing. Like it's like you're a nymphomanic person. And I can feel that people start looking at me differently than before. They look at me as a ghost, like I'm strange, I'm freaky. And so it makes me, yeah, in that way, it makes me very lonely.
In some patients, like Anna, the condition is so extreme that she has to cope with spontaneous orgasms throughout the day.
During the day, I have this pre-orgasmic feeling, but I can handle it by distracting myself. But during my sleep, I can have spontaneous orgasm which I cannot control.
Revealing these intimate details to her doctor was traumatic.
The family doctor answered, "Oh, how wonderful for your husband." I was very embarrassed.
Most of these women have this experience, and that is so hurting and insulting that these women are completely disappointed, go home and are even more desperate.
At this hospital in The Hague, I met with a team of doctors and nurses exploring ways to help these sufferers.
Those women are very desperate, they are very emotional.
Medication is usually the first line of therapy to dampen the arousal. But failing that, many women are referred to a physiotherapist. Dr. De Lint performs a procedure called transcutaneous electrical nerve stimulation, or TENS.
Right, so this is the TENS machine.
This is the TENS machine,
yeah,
with 2 electrodes, a big one.
It's a device usually used to dull pain.
This on the inner side here, on the nerve, and we find the best place to stimulate. We want to stop the excitement of the nerve, so the feeling is better for the patient.
Right, it seems counterintuitive because you're stimulating the nerve,
Yeah, that's.
but yet the feelings diminish.
Yes.
How many women find this treatment successful?
2/3 of the patients has a result in it.
So still 1/3 of women don't find this effective?
Yes.
These TENS machines may be purchased at the local drugstore. But when I was in the UK, Sandra revealed to me, without a knack for using them, they weren't effective.
I experimented with it, putting it on various parts of the lower body and the thighs and all the rest of it. But it didn't seem to do anything at all, so that failed unless somebody can tell me exactly where to put it.
It's important to go to a physiotherapist. Otherwise, you can't find it yourself. And you don't know what intensity you need. You don't know where to place the electrodes.
Sandra also tried physical therapy on her pelvis.
The therapist pressed on certain points called trigger points inside the rectum and vagina, but after a while it actually started making it worse. So I gave up.
Like Sandra, many women are reluctant to have physical therapy. As I found out from Dr. Venema, it often ends up a humiliating experience.
Inside the vagina, we put pressure till we find the trigger points. You must do it very gently, because if you press too hard, they can even get an orgasm on the table. That's what can happen.
That must be so distressing for the patient.
For a woman to have an orgasm on the table when the doctor puts on the area of the critical nerve is very embarrassing.
The great tragedy surrounding this condition is that some patients take desperate measures. It was shocking when Dr. Waldinger told me about one woman who had her clitoris surgically removed.
She told me, listen, doctor, I couldn't bear it anymore, and I really urged the gynecologist to remove my clitoris, but the result was that she still had complaints.
Removing the clitoris didn't help?
No, it didn't cure it.
The clitoris is just the tip of the iceberg. The actual problem lies deeper within the pudendal nerve, located in the pelvis. It branches out to different areas in the pelvic floor, supplying sensory function to the anus, perineum, vagina and clitoris.
Yay! She's here!
Injury to this nerve can happen during childbirth or with lower back injury or strenuous exercise. Australian-based expert on the pudendal nerve is gynecologist Dr. Thierry Van Kayi.
When they come to see us, they will talk about bowel dysfunction, bladder dysfunction, maybe talk about pain with intercourse, but arousal problems they'll leave that for last if they'll talk about it.
1, 2.
Dr. Van Kayi is experimenting with a more permanent solution to this problem. He will use a neurostimulator, which is surgically implanted into the base of the patient's spine. If he can abate the pain, it's likely he will also abate the arousal.
The neurostimulation sends out a signal that competes with the pain signal, and therefore the brain gets confused, so to speak, and ignores the pain signal.
X-rays guide the electrode into the exact position next to the pudendal nerve.
They're within millimeters of the target, and we can really choose the electrode that provides the best stimulation in that particular patient.
At the moment, the doctors are cutting a small pocket in the patient's backside where the battery will sit permanently.
leads are within range with normal impedances.
We connected the leads then to the generator, which is in here at about 1 centimeter below the skin, so that we can access it to recharge it.
Once it's switched on, electrical signals fire 24 hours a day.
This is their controller, like any other remote device. They increase or decrease the intensity of the stimulation, and then they have 1 or 2 programs to choose from.
Another treatment option lies with an injection we usually associate with cosmetic procedures. This patient is about to have Botox injected into her vagina. It's extremely painful, so she has to be put to sleep.
Botox goes into the pelvic floor muscle. Botox works by reducing overactivity of a muscle. It takes about 10 days to interfere with that muscle.
This patient will return within 3 to 6 months to repeat the procedure, since the Botox will wear off. As none of these treatments actually cure the condition, it begs the question, why not just have the pudendal nerve permanently blocked?
This is a very common question. Why not just cut the nerves and let's get rid of them? Well, then you would end up with no bowel function, no bladder function, and no arousal whatsoever. I don't think there will be many happy customers.
Interestingly, it's not just women who suffer from persistent genital arousal.
Yes, well, I've seen a couple of men with it. They'll get pain or a discomfort or a feeling of sexual arousal actually in their penis. They can get it even in the non-erect state.
They have the sensation that they are on the verge of an ejaculation that will not come. From my experience here in the clinic, the number of men suffering from it is rather low. But it might be that these complaints get another diagnosis. And, well, in the future we will know that.
Now, if you think persistently aroused genitals is unusual, well, brace yourself, because here in the Netherlands, Dr. Waldinger tells of an even stranger condition.
A patient was referred to me with a rather strange complaint. He told me that he got ill after an ejaculation.
In 2002, Dr. Waldinger published his observations. He called it post-orgasmic illness syndrome, or POIS. Michael is a working professional, and he has suffered with this condition since his teens.
Within about 3 to 6 hours, I start to get really teary eyes. My concentration just gets really poor, and energetically, I'm really low.
Incredibly, these symptoms can last up to a week.
Well, I have to plan before sex, like what will I be doing in the ensuing days, particularly the first 3 days. And if I know something critical is coming up where I have to be on my game, no sex is the short answer.
Michael has a small window of opportunity to have sex on Friday night. That way he can spend the rest of the weekend recovering.
So I guess there's no room for spontaneity.
I'd really love to be able to be spontaneous about sex. Have a quickie in the morning before work with my partner because we both felt like it, and I can't do that. If I have sex several times, then I can guarantee that I'll have a longer period before I start to feel even keeled again. So...
You try and keep it at 1.
More or less. I'm not an accountant in bed, but I'm a realist.
Professor Waldinger believes that this is a physical problem, And he's come up with a theory that's even more bizarre than the condition itself. He believes these men are allergic to their own semen.
I got the idea because the reaction occurred rather immediately after ejaculation. And that made me think it might be some immunological thing, because immunological reactions occur very quickly, within seconds, within a minute.
By monitoring his patients' sexual symptoms, Professor Waldinger noticed that these men would only get sick if they ejaculated.
I thought, as long as the semen is in the testis, nothing happens. But as soon as it is moving to the urethra, and then you get such an explosion of symptoms, like feeling ill, perspiration, concentration disturbances, and so on. We think in the testis there is a sort of membrane that protects the semen from influence from outside. But that is an hypothesis, and we have to investigate it.
In a small pilot study, Professor Waldinger found that over 88% of men with post-orgasmic illness syndrome were positive to an allergy test against their own semen. Victor is a Spanish student who suffers from post-orgasmic illness syndrome.
When I began to experience my symptoms, I thought that I could be like depressed, but they fade away, so it just makes no sense.
Hello.
Hello.
I'm Dr. Waldinger. Welcome.
Today, he's come to this clinic in The Hague to investigate whether he is allergic to his own semen.
Here it is for the specimen.
Yep. For this, Victor needs to produce that all-important sample.
Nice to see you again.
Dr. Marcus Mayanardi is the allergist performing the skin prick test.
You're allergic to your own sperm. So what I've got here is diluted sperm. So I'm going to put this here, and now you feel a little sting.
Victor's semen sample is diluted out to prevent him from having a severe anaphylactic reaction.
If Victor turns out to be positive for this result, he may choose the option of treatment, which is being injected with very dilute amounts of his own semen over a long period of time, in the hope that he'll build up a tolerance to it.
The treatment is called hyposensitization. It's much like treating allergies against nuts or bee venom. But in this case, it involves a grueling schedule of injections containing their own semen.
These men have to masturbate every 2 weeks when going to the allergist. And that makes them ill, particularly in the beginning. So it's quite a commitment for the patient to do this hyposensitization treatment. Hopefully, we will find other solutions, but we can only do that when more research will be done on this disorder.
It's a cruel irony that these men have to get sick before they get better. But Professor Waldinger says in some cases, the symptoms diminish by 90%.
You can feel yourself here.
It's been 20 minutes, and Victor's results are in.
You will see the redness here. You should also feel the little branches here in the skin. That's an allergic reaction on your own semen.
How does that make you feel?
I'm feeling happy because I know that I have this opportunity to prove that I am allergic, and knowing that in fact I have this condition. So for me it's perfect.
Now you may be wondering why Victor is not feeling unwell after producing his semen sample. About a year ago, he found an internet forum where men from all over the world would discuss the same illness. someone online suggested he take niacin, a type of vitamin B. He did so 1 hour before orgasm, and miraculously he didn't get sick.
It just it has improved my life in all sense. I think I'm more confident about everything, enjoy life, you know.
But if Victor doesn't take the niacin, his flu-like symptoms return. And that's why Dr. Waldinger warns this is not a permanent fix.
We can't cure it, we can diminish the symptoms, but still there's no cure, and that's why more research should be done.
While our understanding of these conditions is still in its infancy, the sufferers continue to search for answers.
I really want to ask medics and researchers to help us out, to contribute in finding a cure.
The best I can hope for is that I'm able to cope better with it. And I'm hoping that the condition will become better known so that people will not suffer in silence.
When I first began researching this story, I was shocked at how little doctors actually knew about this condition. And I suppose that shedding light on these illnesses can only help. And it seems it already has. Michael, our poise sufferer, decided to try niacin after hearing about Victor's success, and he says it's changed his life. So it just goes to show that if you continue to explore, you may just find what lies beneath orgasm and the trouble with sex.
Next time on Catalyst, saving lives in trauma, matchmaking pygmy possums, flood impact on the coast, and the physics of slinkies.